Daily Show with CJ Nasello on RiverBender.com.
A lovely
Welcome back. 9:19 is the time on this 24th day of October, a Tuesday morning. I don't know about you guys, but it seems like the week is just a crawl until Wednesday, and then Thursday, Friday hit, and boom, you're back to Monday. You know?
Right.
I agree.
Absolutely.
And then the weekend.
Yeah, it's the first time. That microphone has exploded on me. Look at that. Now it's sensitive. You talk to it nice, and it's good to go. Yeah, here we go. So Mike and Charlotte in studio. OSF Saint Anthony's Healthcare really introduced a really big thing to the region, this wound care center of excellence. And Charlotte, Mike, right off the bat, how'd everything go since this launch of this on the 19th of September?
Well, we are excited to be able to offer this to our patient population. We are growing by leaps and bounds, new referrals all the time. We see new patients all the time. Mike has been instrumental in helping us, get out there to the community and telling, the doctors in the community about what we're doing. So,
well, and take us through that partnership, if that's okay, how Healogics comes in with OSF and partners up and spreads the word and raises awareness. Mike, fill us in on that.
Yeah, Healogics is a company that contracts with hospitals all over the country. Mm-hmm. We work with 640 different hospitals in the U.S. We also have some in the U.K. And we provide a lot of science and information and data on wound care all across the board, whether it's a diabetic ulcer, venous ulcer, pressure wounds, surgical wounds, etc. We have data from literally thousands of patients that we've worked with.
Wow.
And we provide operational support for the hospital and marketing support, and not just for out visiting providers, but for social media and folks like you.
Yep.
And we provide as much guidance as we can, and the folks at OSF have been great to work with, a fantastic partner of ours, and there's a lot of exciting things happening there, and the staff there is very passionate, very dedicated to what they're doing, and the sky's the limit for this clinic.
Absolutely. And Charlotte, take us through how it's been working with Healogics on this, and take us through that partnership, because it seems like a perfect fit for both parties.
it is. It's a great fit. So we currently provide the nursing staff and the provider staff. So we have a team made up of Dr. Alejandro Sanz. He's a surgeon, one of our surgeons. He does clinic hours, and then we also have Leah Kanabi, who is a nurse practitioner, does great with our patients. So we team up with the Healogics, as he said, their evidence-based practices that they give to our nursing staff. We just follow those protocols. We, focus on, healing, and focus on the things that, revisiting those patients and bringing them back in. Our patients were excited to have this opportunity for our patients. We have a very loyal client base at Saint Anthony's, and, we really want to be able to offer that to our patients.
Well, and how important is it to have a center like this? Because I was looking at some of the numbers just on, the article from a couple of weeks ago whenever we ran it. I'm looking at 6.7 million people that are living with chronic wounds.
Yeah.
I mean, that's something that I don't know how to experience that, and how much of just a hurdle that is each and every day. Mm-hmm. How important is it to have something like this for the Riverbend region?
Right. Yeah, I mean, it's very important. Right, those diabetic ulcers that just chronically, don't heal. Helping them get through that, helping them through the pain. Right, that's something very painful. It's debilitating to their daily functions. Mm-hmm. So it's really important that we help them heal those wounds.
100%. And then the first day, were you expecting the amount of, just kind of positive feedback, the amount of people that were coming in? Did you expect that to happen?
Well, we always want to expect more.
Yeah,
right?
Good answer.
Right? Exactly. But, I'm excited by, each week we have new referrals. So each week we have patients calling on their own because they hear about us and they say, hey, I've been waiting for the wound clinic to open there at Saint Anthony's. And so they kind of do that self-referral. We always want to make sure that their doctors, know that they're coming. But we have so many patients just calling on their own. So
that's incredible. That's actually a great thing. And then also, Mike, with Healogics, take us through how the technology's changed and how you guys have changed and evolved as a company since you've started on with the team.
Oh goodness, the wound care industry, per se, is ever developing. We've got research people that develop white papers all the time to keep providers and nursing staff informed on changes in the industry, different types of things like, say, for example, skin grafts. To help heal the wounds. I mean, that industry alone, there's so many things out there, whether it's amniotic tissue. There's even one company out there that sells tissue for made out of fish skin to help heal wounds.
Yeah.
It's pretty amazing.
Whoa.
Yeah. I mean, back from the days where we used to take the skin grafts from their own bodies, we have these, manufactured. Yeah, the technology has definitely changed. Yeah. We currently are not offering the hyperbaric, but we're looking to hopefully maybe expand on that over the next course of time. So that is also another resource that we could offer to the patients.
Well, and Charlotte, too, on top of that, take me through how important it is to have this, because I'm not a medical person. I don't try to, right? And I like to ask questions that I don't know the answer to. I mean, it seems like this is something that is one of those things that could help sustain life and viability for years upon years.
Right.
Without that, I mean, do we see shortened life expectancies without having wound care centers?
Sure. I mean, these patients with open wounds have such a risk for infection, right? They're already sick. They have such comorbid conditions. They might have diabetes, which we know is, a chronic condition that doesn't, sometimes get better if it's not managed properly. And these wounds just kind of keep there. So sepsis is another thing that could happen because this wound gets infected. And so the providers do a really great job of keeping an eye on those wounds weekly, ensuring that if it looks a little, off from the last time that they saw him, that they do, cultures and then, get them the appropriate antibiotic or go back to their doctor to kind of get them extra treatment. Yeah.
I want to emphasize something that Charlotte just mentioned. We see our patients on a weekly basis.
Yeah.
Wow.
Okay.
I honestly didn't expect that either. I thought maybe every couple weeks or a month.
Yeah, it's every week.
Yeah.
And part of the reason that is that we can see the progress and how the wound is healing.
Yep.
Also, if the wounds, they can change, it can get either way, better or worse. And so the providers can go ahead and debride the wounds, which is like cutting out the bad tissue, okay? And, we can get that healed faster when we see them on a weekly basis. And not just is it good physically for the patient to see that progress of them healing, emotionally it's huge.
I could only imagine that aspect in the mental side of things, because to me, if I have something like this, I'm going to notice it every day, and it's going to make me feel pretty bad about the way life's going, and to have that opportunity here locally is a huge incentive. And then, Mike, on top of the partnerships and Healogics working with all these, what do you look for in your hospital partners?
That's a great question. I'm glad you asked that. And, again, to reiterate what I said earlier, we're very fortunate to be on board here with OSF. A hospital that's committed to their patients. I worked at 23 different hospitals in my role, okay? And I know that there are some hospitals out there, when, in all honesty, it's about the dollars and cents.
True.
Okay?
True.
There's a passion here with OSF where it's about the patient. It's, patient-centered, and the patients are actively involved in their treatment and their care. And to have that collaboration between the hospital and the patient and Healogics is huge. You can't put it into words.
Without a doubt. And actually, that's a perfect pause point. I got to pay a bill, so let's take a pause right here and let's keep this conversation rolling. On this 24th day of October, a conversation with Charlotte, Mike, OSF Healthcare, and Healogics continues right after this quick break in the heart of the 618.
Here at Modified Auto Sound, we are an automotive customizing shop that specializes in car audio, window tinting, and other truck and Jeep accessories. So as an interested customer, we always recommend that you just stop in the shop. Check us out at 241 Eastgate Plaza, right off of Route 3 in East Alton, Illinois. At Modified Auto Sound, there's no such thing as strangers, just friends we haven't met.
Megyesi Insurance Agency, providing quality products with extremely competitive prices. As an independent provider, we source multiple companies to offer the best rates possible. Covering auto, home, business, and life insurance, our goal is to provide quality service that meets and exceeds customer expectations. You can rest easy knowing the Megyesi team is working round the clock to ensure that both you and the most important parts of your life are covered. Our qualified professionals make the insurance process easy so you can live carefree and focus on what matters most. Visit MegyesiInsuranceAgency.com today to find out what our team can do for you.
For the biggest selection of pre-owned cars, trucks, and SUVs in the Riverbend,
visit AltonToyota.com or stop by their location on the Homer Adams Parkway in Alton. Winner of the prestigious President's Award, Munganass Burkhardt Alton Toyota knows how to treat their customers, and they will help you find the vehicle that is perfect for you. For years, Munganass Toyota has been a fixture in the Riverbend, and now Munganass Burkhardt carries the tradition. New name, but the same great service you've come to expect.
I set the thermostat so my house would be warm when I got home from work, but the kitchen is still cool.
At Barrett Heating and Cooling, we stand behind every Linux system we sell.
My dealer said he'd take care of everything.
At Barrett Heating and Cooling, we understand everyone wants prompt, professional service.
Turns out it wasn't my furnace after all, just a little something blocking the vent.
Pretty smart dog if you ask me. For service you can count on, call Barrett Heating and Cooling.
Lennox, innovation never felt so good.
Has free checking become a thing of the past? Not if Liberty has anything to say about it. With 3 free personal checking options and even a free business checking account, Free is alive and well at Liberty Bank, the local bank that gives you free checking choices and more cashing in your pocket. Bank locally, bank Liberty. For more information, visit www.bankliberty.com.
You're listening to Our Daily Show with CJ Nasello on RiverBender.com.
Losing control, yeah, I'm all over the place. Clowns to the left of me, jokers to the right. Here I am, stuck in the middle with you.
Just pondering some great thoughts at 9:30 on the dot. The 24th day of October. Our daily show continues on a Tuesday morning with Mike, Charlotte, OSF Healthcare, Healogics. Am I saying the company right?
Yeah.
Really? I normally botch something in interview, Mike, so I was kind of wondering here if I'm just stringing along here.
No, you're a trained professional. You're doing well.
That's right. Trained semi-professional. With that being said, you know, being able to really talk about this, when we saw the article, press release come out here at Riverbender, Dan and I upstairs went, this is a huge deal. I mean, to have something, a wound care center like this, right here in the Alton area, the Riverbend region, is a huge incentive for so many people. They don't have to drive the 270 war zone anymore and worry about that. How has just the relationships that you've had with your patients increased since this? Because it seems like there's a better understanding when you aren't jumping from doctor to doctor and re-explaining what's going on.
Right. Yeah, we mentioned that earlier, right? We have that loyalty of our patients. So they appreciate that when their doctor refers them to the OSF clinic, it's an OSF doctor, right? They may have already experienced some of the relationships with the physicians or the doctors they're seeing in the clinic and the nurse as well. So I want to give a shout out to Rebecca, who is one of our wound certified nurses. She has inpatient experience, so she has seen some of these patients on the floor in the hospital already. So them following up afterwards at the outpatient clinic, friendly face. We see them weekly, as Mike mentioned, so they build those relationships, and it just helps them kind of build that trust, right? It's all about trust in healthcare. Yeah. We want our patients to trust us.
Well, and we were talking too about kind of some of the expectations that are set during the commercial break, because these are serious wounds and they lead to serious things. And when you're looking at the possibility of an amputation, you name it, take me through how important it is to have that kind of compassion and then the mental health aspect side of things when you're talking to somebody about the potential of, hey, you might have to lose this leg.
Yeah, these patients come in exhausted, right? Yeah. They're walking in pain. They may have debilitating ability, like in their daily lives, they're not able to get to the couch, to the kitchen to get what they need. They maybe lack the support, nutritional support at home to kind of help heal these wounds. And so giving them the place that they can go to, or giving them the ability to see somebody on a regular basis, it just gives them that support. We do a lot of kind of coaching and like mental health help, hey, you've got this, you can do this, instead of dragging them down and saying, oh yeah, this looks bad. I mean, we want to encourage them, help them, give them support, maybe diabetes education, maybe give them offering other support outside of the hospital to kind of give them maybe money for food, or a lot. It goes in so many different aspects when you're looking at chronic conditions.
Well, and on top of that too, Charlotte, you were mentioning Rebecca. It seems like you really have to be made and almost specifically specifically built to be a wound care, nurse. And I mean, that's not an easy job. So how important is it to have the right people like Rebecca in your office, being able to handle these situations?
It's amazing. You see a wound that has stuff coming out of it, right? It takes that special person, and she just jumps right on in there, and she's hands-on and cleaning wounds up so that it doesn't look so horrendous for the patient. I mean, we've talked about that mental, you see this body part that just is oozing or weeping, and just helping them work through that and giving them the supplies that they need at home, right?
And then we were also mentioning, too, during the break, the word chronic and what that means. Because, when I think chronic, this is something you're dealing with for the rest of your life. This isn't going to go away. So what's the stage look like? Let's say that we're getting progress, we're cleaning this wound up, it's, maybe dissipating or it's looking better. What's that look like afterwards, after they leave the center?
Well, we hope that we get them to that point that wound is barely visible, right? Not an open wound. It's closed really nice. It's got all that healthy tissue kind of growing. And then what, right? So we want to make sure that we kind of still follow up, that they're still seeing their primary care physician, that they're still taking medications that help with diabetes or things that can cause infection or cause these things to reoccur, right? So when you have diabetes, that's the chronic condition. That's the thing that's never going to go away. So let's give them that support that helps prevent those diabetic ulcers in the future.
Right, and that's not just the education, but it's a lifestyle change.
100%.
Yeah, because these people, these people have gone through this. They may need to change their eating habits, their exercise, their whole pattern of their daily routine might change. And, we provide, support and education and, nutrition information. And Charlotte and I were just talking during the break about getting nutritionists involved with the wound care side. And so there's a lot of exciting things that the clinic can do to help people, not just with the wound, but with life in general.
100%. And on top of that, I wanted to follow up about just Healogics too, because I was going through the write-up again and just seeing the peer review data, and how, just wanted to ask you, whenever you have so many partners in hospitals, how important is it to say we have this peer-reviewed data? Because, there's a lot of data that you're getting and being able to relay to other individuals.
Right, and, credibility is a thing that, patients need to know. That what our providers are telling them, I'm not going to say it's gospel, but OSF, I guess it is.
I love
it. But the knowledge that the providers have, available from Healogics, it gives them, better expertise level, better confidence, and a better way to relay this to the patient and illustrate the care that they're getting. And yes, this is going to work. And you have to trust us, because there is going to be a trust, a rapport building time in the wound healing process between patient and doctor.
Well, it goes back to just how important, too, Mike, that communication is. Without being able to communicate with the patient and really in a transparent way, here's where we're at, here's what stages we're at, here's what you're going to face. And that's what goes back to being on the OSF side of things, how important it is to have that patient relationship and that care management plan.
Right. Exactly.
And, Charlotte, with that being said, what are you most hopeful for? And I don't want to say, excited about, because wound care isn't something to be excited. This is a serious thing. But to have this here in the area and to keep developing OSF and adding components like Molar Cancer Center and the Wound Care Center of Excellence and all these other huge components, it's got to be an exciting time to be a part of the staff at OSF.
It is. And we are excited. We're excited to touch the community, right? This is what OSF and that, our executive leaders and myself included, is we are bringing care to the patients that we serve. This is Alton, our Alton community and the outside areas, and we want to touch every single person that we can. And there's probably people out there that don't know that we offer these services, and those are the people that we want to know that they can come to us, because we are offering evidence-based care. We are offering all of these things, and we really want to make sure that the community, we serve the community in the right ways.
Without it, before I let you go, I have one final question, and that's about the caregiver and just the family members and maybe the supporters of the individual going through it. I mean, a tough battle. How important is it to have a good relationship with them and making sure that they're kind of, I don't want to say being the watchdog or being the boss of the patient, but making sure that things are getting done and we're meeting those objectives and goals and care.
Sure. Education, right? I mean, the same education we give to the patient. When you're the patient and you're in that small little box, you're hearing what you want to hear, right?
Yep.
You know, and so having that support and having one more person in the room with you to kind of hear what we're telling you, and that's important in anything in healthcare, and that's maybe my public service announcement is that, you know, for anything in healthcare is that, you know, take a friend with you so that you have more people involved so that they can help support you outside of the clinical setting.
100%. And then, Mike, coming back to you with just Healogics, what's Healogics looking to do in the next couple of years? Do you guys have a plan, just add more hospitals, making sure you can keep growing, or what's that look like for Healogics?
And that's a good question, and a lot of that's above my pay grade.
Good answer.
At the same time, you know, we look for hospitals that, as I mentioned earlier, are passionate about wound care. You know, as with any company, of course, we're looking to grow. Okay?
Right.
At the same time, we're also looking to advance on the clinical side.
Yep.
You know, keep fine-tuning the processes that we have in place, looking for process improvements where we can. You know, utilizing the latest technology and the latest, you know, research, and enhancing our wound care as much as possible to heal patients. You know, we have a mission statement at Healogics that says, find, treat, heal. We go out and we find the patients that need, you know, to be treated. We get them to the hospital, okay, and they go through the treatment and then they heal. And hopefully we never see them again.
Yeah, 100%.
Yeah.
And Mike, Charlotte, I mean, this is just really exciting, and it's an exciting time for the Alton area to have all these new advancements in medicine right here in your neighborhood. I mean, that's a huge bonus, and to have Healogics partner with OSF, I mean, that's a big deal. So for you guys to come down and fill us in on this, I really appreciate it, and have a great rest of your day, and thank you for your time.
Thank you.
Thank you.
We'll take a quick break. 9:41's the time on a Tuesday morning. We'll come back, talk about events and the fun you and the family can have this weekend, and then we'll plan ahead for the 10 o'clock after this in downtown Alton.